So we're going to imagine this ball is our baby. With a forward pull of the abdomen, it can orient our pelvis forward into an anterior pelvic tilt. This can cause us to have a high lumbar curve, a high hinge point, which can put a lot of pressure on our mid-back. Conversely, we might end up tucking our pelvis back and glute clenching to hold the position forward, hyperextending our knees. Those glutes get really locked up and then lose their extensibility. The other thing we can do is to combat the anterior pelvic tilt. We can end up swaying our shoulders all the way back, again hyperextended knees, and this can make it hard to get a decent pelvic floor contraction or 360 breathing. So we want to think about stacking over our major joints. So for most of us, we'll think hinge at the hips, there's more weight on our heels, and that our ankle bone and our mid-knee are aligned. We're going to tuck our pelvis under posteriorly, expanding the rib cage while retracting the lower abs to come to tall standing with a slight anterior pelvic tilt to get there. This should really help circulate the air all the way around your sides, belly and back. If you think about a Coke can or a helium canister, just getting that nice uniform, even spread of air throughout your core canister. The other thing you can do is take the wall test by standing with your head, shoulder blades and buttocks touching the wall with your heels about 5 to 10 centimeters away. Slide your hand behind the curve of your lower back with your palm flat against the wall, and ideally you'd feel about one hand's thickness of space between your back and the wall. If there's too much space, you might need to retract abdominal muscles. Think about that 360 breath and that exhale to flatten the curve in your back. And if there's too little space, arch your back a little bit so that your hand fits completely behind you. Walk away from the wall, trying to maintain this posture, and see how it feels.